Mаттиас. Usually we make the rehabilitation course in Kaltenborn as the last one, the 9th. What is your idea? The stabilization is so important. Shouldn't we make it as the first one?
To do it the first time, I think, or as the first one, it's too difficult because you have to understand a little bit the anatomy and biomechanic of the whole body, what happens during which movement, to understand what happens inside the joints, which structures are coming on stress, which are getting relaxed. So it's necessary to have some knowledge before you go to this high level of rehabilitation course to understand really what's going on there in the whole musculoskeletal system.
But the understanding of hypermobility and hypomobility is very well demonstrated during the rehabilitation course, even better than during the start courses. Maybe there is reason to give this distinction earlier.
There's a possibility, but we educate high professionals in the whole musculoskeletal system. So we need people who are able to assess and to figure out very specific and exactly what's the problem of the patient. Because a lot of patients are hypermobile, for example, between L3 and L4, but have a big restriction between L5 and L1. So it's not enough to know something general about instability or hypermobility. You need a specialist who is able to figure out what's exactly going on in the spine or in the peripheral joints.
Okay, I got it. Tell me please, we have invited a few trainers from this fitness, from this gym, just to attend this course, and we wondered if they would understand what happens, because these are the guys who don't really have the full basic knowledges. And first day we've seen that they were a little bit sad, but they're totally involved now and they're happy now. What is your idea about the possibility to invite and to involve people without pure medical education, but people with coach education?
So it's a possibility to offer them courses similar to this, but the quality is not the same as if you have got only people in the course which are really have a good basic education in this field of musculoskeletal system. So we changed the program a little bit so that everybody in the group is able to understand what we are talking about. If we would have only specialists in this course, we would have, I think, another level we could start with, and everything is possible. The more people which are educated and get information about this theme, the better it is. But on the other hand, it's the question who is sitting in the course and how can we bring them together.
Okay, thank you. And the last question. How did it happen and why did it happen so that Kaltenborn-Event concept and orthopedic manual therapy are the subjects of your particular attention, your profession, and as I understand, the very much beloved part of your life?
It's a very important part of my life because I get always answers on my question in the musculoskeletal field. So if you are able to do a really good diagnosis with the patient, you will always come to a good solution for the patient, and you can help nearly everybody if it's a musculoskeletal problem. If there is a hypermobility, you stabilize. If there is some restriction, you mobilize. If muscles are too weak, you strengthen them. If muscles are too short, you stretch them. So it sounds very easy, but it's very difficult to come to a conclusion and then solve the problem of the patient. But in this field, in manual therapy with Kaltenborn, we always get the answer on your question.
Okay, thank you so much.
You're
Mаттhias.
welcome. It's my pleasure.